Welcome back to Age Better, Dr. Margaret. It's really so good to have you back to talk about this very, very important topic, mental health during menopause and after menopause.
I'm really excited to be here. I think this is a great topic, and I think we're going to have a lot of fun.
Okay, so let's dive right in. Dr. Margaret, let's start with this. Explain how fluctuations in estrogen during menopause can really contribute to mood swings, and what can women do to try to manage these rapid changes and to kind of help with their kind of emotional states that are also in fluctuation.
Basically, menopause is the period of time where the ovaries are no longer producing estrogen, and so estrogen levels are going to plummet. And this could begin in perimenopause, where hormone levels are up and they're down and they're kind of all over the place. And very interestingly, estrogen has a big effect on the brain and a big effect on our mood, on our general state of well-being. And so it's really not surprising that in this time of transition, whether it's perimenopause or after menopause, there are a lot of factors that contribute to our mental health or state of being. So for instance, people can have mood changes, they can become more irritable, they can be more depressed, more anxious. This is very commonly seen. Also, this is a period of time estrogen really helps you sleep better. And without sleeping, we all know that that can create some negative mood and be more irritable if you haven't had a good night's sleep. In addition, low estrogen causes hot flushes. And when you're having hot flushes all day, you don't feel well. And so if you're not feeling well, that also creates a state where your mental health can be in jeopardy. It's also a time of life where things are really changing. No longer have a period, no longer able to conceive, and that creates a lot of difficulty for many, many, many people. It can also coincide with a time when you might be changing your job. Some people have children that are leaving the home, so there's a lot of problems. Also, the fact that when hormones levels drop, your libido decreases, and that can often create some difficulty.
Yep.
So we think there are so many factors that are involved, but the big thing to realize is there is a big link between a drop in hormone levels and an increase in mood changes.
Yeah, and fluctuations in mental health in general.
And mental health in general.
Yes.
Yes.
And so some women experience an increase in anxiety and depression during menopause. And so how do changes in estrogen levels affect the neurotransmitters like serotonin?
Right.
And what are the best approaches to managing these mental health challenges during this time?
Well, just as you said, estrogen has a direct effect on the brain and can change the neurotransmitters. And it doesn't happen to everybody. Some people, in fact, feel well and feel completely fine. But in other people, it really is a big change. And so I think the big thing to do is to recognize that menopause might be a reason why an individual might be having these new mood changes and might be more depressed or might be more anxious. And so this is a time to get some help, whether it be through mental health providers and help with some therapy that way, or whether it might be through hormonal manipulations or antidepressants, both very reasonable medical additions. And also lifestyle changes, just really recognizing that this is an issue and managing, trying to get sleep, exercise, eating well. But
managing
hormones,
stress as best as possible during this very challenging time of life.
But estrogen and hormone therapy really might be helpful in helping to alleviate the anxiety and alleviate the depression. I have seen so many examples where people have come to me where they've entered menopause and they're just feeling so much more anxious that the same tasks of the day, which used to be very manageable and have no difficulty, all of a sudden that is creating this state of being overwhelmed and having too much to do, or just feeling too anxious about something, or more depressed than usual, or losing their temper much easier than before. And then with the addition of a small amount of estrogen, they're back to where they were before. And those feelings and that increased anxiety can become manageable and back to where the state was before menopause. And so I think certainly for many people, estrogen might be the answer. I think it's not for everybody, but for some people, I think that's a great option.
Right. And, you know, so many women talk about brain fog. We hear that term
Yes.
a lot during menopause and even after.
Yes.
And so what causes those cognitive changes? And are
Right.
they, which is a little bit different than being anxious or depressed. And
Right.
are they temporary? And what do you suggest
it
that how they
depends.
handle
I mean,
this?
it's a great question. So we know that estrogen has an effect directly on the hippocampus, which is the part of the brain that's responsible for memory. And we know that without estrogen, many individuals have a loss of memory. And just as you described, a feeling of brain fog where there's not a clearness or a crispness anymore, and little subtle factors become, you can't remember where you put your glasses are sitting on your head, you can't find your phone, you're talking on it, you can't remember names, you remember the person, you remember the conversation, but you can't remember their name, or you can't remember nouns. I always give the example of you're giving a lecture and you want to say banana, but you can't remember the name. And so you circumvent and you say the yellow fruit that you peel. This is all connected to lack of estrogen. And then when you feed estrogen back in, boom, that brain fog dissipates and you can remember things. And it's incredible how fast you can actually get relief when you add that estrogen. So brain fog is definitely one of the symptoms that comes with menopause. And that could be in association with other factors, such as depression, such as anxiety, or it could be completely alone. Many people get the brain fog, but don't have any of the other factors. And then you asked about cognitive functioning. So that is a cognitive function, which is the ability to remember and memory. But one thing that has been found and about the linking is that people that have had depression, particularly in this midlife period of time, seem to be at an increased risk for developing cognitive decline and Alzheimer's when they get older. And I don't know if it's a direct relation and a cause and effect, or it's just that people with depression seem to have a higher chance of having dementia.
Right. We'll talk about depression in greater detail in a little bit, but for now, let's go into sleep, which you did reference earlier, so important to helping manage our mental equilibrium. So sleep problems are very common during this period of time. As you mentioned, hot flushes can make you, wake up in the middle of the night. But let's talk about that. How does lack of sleep really impact our mental health?
Really interesting that estrogen is unbelievably helpful to help people sleep. It's particularly good on that time of helping people fall asleep. So people that are in menopause that have no estrogen, one of the things that they say is they're able to sleep till about 3 a.m. Then they wake up maybe to go to the bathroom, or they wake up, but then they can't fall back asleep. And that time, from the time you put your head on the pillow to the time that you fall asleep, is called sleep latency. And there have been several studies that have shown that estrogen directly correlates, that the higher presence of estrogen allows you to have a shorter sleep latency. So, but you really asked me different question, not how estrogen relates to lack of sleep, because it does. But once you have lack of sleep, why does this affect your mental health? There are many, many studies looking at sleep, and it seems that we really need to regenerate our brain cells. And I think almost everyone has recognized that when you get a bad night's sleep, your next day is not as good. And when you have 3 consecutive poor, not well slept nights, you're going to be even less able to carry out your normal functions. And we've seen from studies in different arenas, whether it's in the medical field or in aviation, that people don't function as well when they haven't had sleep. And so that lack of that regeneration, the lack of the nerve cells from getting that proper sleep, can create all sorts of instability in the brain. And this can manifest itself in many ways. Inability to complete tasks, being tired, but also moodiness, irritability, etc.
And also, I think if you're tired, if you're suffering from lack of sleep or poor quality sleep, you won't be as inclined to do things that are really good for yourself, like exercise.
You don't have the energy. You don't have the
you just
energy
won't have
to
the
get
energy.
up there and
or
do
or
what you should be
socialize,
doing.
which is also very important
Such
during
an
this
important
time.
area.
Yeah.
Absolutely.
So menopause, as we know, can increase stress levels. We've kind of referenced that already, and can lead to irritability for sure. I remember back in the day.
Absolutely.
So what are some effective ways women can manage the combination of physical and emotional symptoms to reduce stress levels and kind of maintain their equilibrium during this period of time?
Well, I think it really is an individual decision on what makes each person feel more comfortable. So for some people, it might be exercise, eating well, going for a long walk, talking to a friend, having some social life, having connection with people. Therapy can be important, seeking out mental health providers, going to a yoga class, doing meditation. These are all things that have been found to be helpful for some individuals. And I think sometimes it's a matter of figuring out what's best for you, because you and I may have very different ways of finding out. I might think meditation is the most helpful thing in the world, and you might hate it, or the reverse might be true. So I think understanding what the possibilities are for you, such as a good walk, a good conversation on the phone with a friend, a good book, a movie, anything that seems helpful, calming, and reaching out for a mental health provider, a good yoga class, but also considering estrogen. That might be the right thing, and that might be what you or I need to make us feel more comfortable in this new environment of menopause.
Let's now talk about sex and how this all impacts our sex drive. We do know that hormone levels fluctuate during perimenopause and menopause, and it can, doesn't always, but it can decrease your interest in sex. And certainly when you're experiencing a dry vagina, for example, which is also a symptom that we're not really kind of focusing on today,
Yes,
but that can also make sex unenjoyable. And then, your sex drive is decreased even more. So how does this aspect of menopause impact women's mental health and self-esteem and their levels of happiness? And how does this impact that?
Well, exactly what you just said. Exactly that. All of those reasons. Hormonally, because there are so many hormones that are responsible for attaining libido. There's testosterone, there's also estrogen, and both of these levels are going to be lower, particularly your estrogen. And just as you said, low estrogen, dry vagina, lack of moisture, feeling uncomfortable, all of the things that you described, lack of self-esteem, just not feeling well, being exhausted, not having energy, being moody, being angry. Those are all feelings that usually are not conducive to wanting to have sex.
Yeah, and also I'd like to add in that, let's assume a woman does have a partner in life, a sexual partner, and perhaps she is moody and all of the things you just described, and perhaps her partner doesn't understand what's happening and is reacting, and that could create a whole issue right there. Which is where maybe a mental health advisor could help.
Relationships can struggle. In fact, I have many examples of where absolutely, this is a time where a lot of difficulty can be seen, especially around sex and sexual relationships. So
yeah. And this is one reason why when you and I talk on this podcast or, write something up in Menopause Cheat Sheet, our newsletter, we often talk about how important it is for women to share what they're experiencing with their partners and their children and their coworkers and really everybody, so everybody understands. So there's less friction, right?
I mean, I think the sharing aspect depends on the individual and the couple and whoever it is. But of course, open communication is often helpful. And working with either a healthcare provider or a medical provider or a combination of them both can be very helpful. Absolutely. But I think that sharing just brings up one of the other factors that can be so helpful, I think, in life in general, but having some connection with other people and shared experiences. Sometimes it's really helpful to know that you're not alone. You're not the only one that is suffering during this period. And what has helped one person might not help another, but they've also been through this and been through an experience. And so that shared experience can be really helpful.
And, this is also a time, I think, in a woman's life where, and you did reference it earlier, where she's no longer has a period, probably no longer is able to get pregnant. And some women can view this as a loss, like such a change and a loss of something in their lives. And that's can also wreak havoc with their self-esteem and how they define themselves. And so how can we address that? Because that's a big part of mental health as well.
It's very hard. It's a very difficult time and a difficult time of life. And, I think just recognizing it and being aware. And I think that's the big thing, is the link between menopause and this, as you said, change of life. It used to be called the change, right? So recognizing that the change of life and your change of what you're doing can be hormonally manipulated. And when the hormone levels are decreasing, sometimes restoring those hormone levels can just make you feel a lot better. It may not change
what's happening.
Outcome. Your ovaries are no longer working. However, it can be fantastic to be able to really improve how you feel and how you feel about yourself, which can, and also, all the other things that we talked about. It can help you sleep. It can help your memory. It can help you remember names and nouns, and all of that can often make your day a little bit better.
And I think also what you just said a few minutes ago about that shared experience, you're not alone, reach out to other women, maybe in chat groups and the like, or whatever the forum happens to be, and your girlfriends perhaps who are also experiencing the same thing. And I think that certainly has helped a lot of women that I know personally. So now we're gonna jump over to depression for a bit, because not all women going through perimenopause or menopause are going to be depressed.
No.
But as it turns out, that women who have had bouts of depression, their risk for depression is greater when they're going through menopause for a lot of reasons. But recent studies also show that women are 40% more likely to experience depression during perimenopause than those who aren't experiencing any menopausal symptoms. So that's an interesting correlation. And as I said, women who have already had bouts of depression are more at risk. But let's talk about that. So depression has been identified as a potential risk for dementia later in life. And so can you explain the connection? And also, why is there an increased risk of depression to begin with during menopause?
So I'll start with the second part, which is the link between the depression and menopause. And I think it comes down to the same thing that we've been talking about, which is that estrogen has a direct effect on the brain and a direct effect on these neurotransmitters. And so without estrogen, these nerves are basically firing differently. And the whole area of research of hormones and how it affects behavior is fascinating and it's difficult to study, but certainly has been studied over many, many, many years. In fact, that's what I did my thesis on in college many, 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 many years ago. But it interests me, and unfortunately, it interests a lot of people. So there has been research in this area. But the second part of your question is not really known. We know that lack of estrogen increases the risk for depression, increases the risk for anxiety, increases the risk for mood disorder and mood instability. We know that. And we also know that people who have had depression are at an increased risk for dementia. But what we don't know is why. And we also don't know that alleviating the depression might change your future onset of dementia. We think that it will be helpful. And we think that by avoiding it and correcting the depression, that there will be the decrease, because we see this association, but we don't know for sure. But we do see that getting help for the depression is certainly, we do recommend getting help during that period of time, whether it's through cognitive therapy, behavioral therapy, whatever therapy that you're looking at, and or medical assistance, whether it's with hormone therapy or others.
Right. And how does depression really contribute to cognitive decline? And what should women be looking for in themselves or in others of friends or family members who might be experiencing this to indicate that maybe their mental health is being negatively affected?
You can necessarily look for this in other people. I mean, I think that for yourself, one thing that I think we're talking about is really menopause and what that does to our mood, and that there is a connection and that we see this. How does it manifest? Sadness, lack of appetite, sleeping a lot, not being yourself, not having energy, loss of interest in doing an activity. Things that you used to find enjoyable, you no longer find enjoyable. These are all areas, ways that depression may present itself other than just a general sense of sadness.
You mentioned before that chronic depression can lead to atrophy of the hippocampus. Can you explain how this affects memory and what it means for a woman's risk of developing dementia down the road?
Right. So we've seen that people that have depression and they have later on MRI scans, that on those images, they have seen atrophy or loss of tissue in different areas within the brain. And that when people have this loss of tissue and loss of substance within the brain, that does create cognitive decline or lack of ability to function in a normal fashion. In other words, can't remember as many numbers in a row, trying to find words that fit together, not having that same memory. And again, that association has been seen in people who have more commonly in people that have had depression compared with people who have not had depression.
Mm-hmm, mm-hmm. Now, I want to talk about something that I find infinitely fascinating. I've had quite a few medical experts on the show talking about it and what we can do about it, and that's inflammation, chronic inflammation, which it is now believed and understood to be the root cause of so many common illnesses and diseases, including Alzheimer's and certain cancers and so on and so forth. And so it's now known that chronic inflammation is another factor linked to depression and dementia. So how does inflammation play a role in these conditions, and what can we do about that?
I think that keeping a healthy diet and getting exercise,
the basics,
trying not to get sick, I think it's a great way to try to keep our inflammation low. Certainly we know that not having as much inflammation is going to be better for us, but I don't know that we have all the answers.
Right. So depression can also cause changes in our cardiovascular health, which, may then increase the risk of vascular dementia, as we know. So how can women protect their vascular health to minimize that particular risk as they are in this stage of life? But I guess you would recommend all the things that we would do anyway, like you just mentioned, eating the right foods, working out.
I think that what you do for your vascular health of your heart is going to be what you're going to do for your vascular state of your brain. You want to decrease the likelihood of having atherosclerosis or plaque build up in your blood vessels, whether it's for your heart or your brain or anywhere else in your body. So if you want to decrease that plaque buildup and keep these vessels as open and transporting all the good things that they do, we want to keep our cholesterol level low, not have an elevated cholesterol level. We want to get plenty of exercise. We want to have enough vitamin D. We want to sleep well, eat well. So all of those factors, not have diabetes, all of those things can be helpful in preventing atherosclerotic heart disease and also brain disease.
Yes, absolutely.
And I think that really brings us back also to the question of hormone therapy, because it has been shown that if you start estrogen treatment early, within the first, they say 10 years, but maybe even 5 years, or maybe immediately when menopause occurs, it has been shown that estrogen may be protective and decrease the likelihood of developing heart disease or brain disease. So that treatment that might be a potential treatment for your mood changes, for your anxiety, for your lack of sleep, for your hot flushes, might actually be benefiting you in keeping those blood vessels as healthy as possible. So maybe estrogen is the answer. But of course, it's not right for everybody. It has to be for the right individual.
So let's talk a little bit about some like the antidepressants. We have been covering depression. Very often, the first line of defense could be a medication for that, but they have side effects. So, excuse me, that can impact cognition, right? Especially in older adults. Now, I know we're talking about really perimenopause and like newly menopausal, but what should women be aware of when it comes to cognitive effects of their depression treatments?
I think that is best done with a psychiatrist or with your medical provider, but certainly antidepressants. There are so many fantastic antidepressants that are out now, and considering the right one for the right individual is certainly an excellent option.
So let's now kind of close out this episode with an overview of what can women do right now? Like, what can the Age Better listeners do today to, changes in their lifestyle, perhaps, to mitigate the risks of any kind of changes, major changes to their mental health?
I think what I would say to that is not everybody has to change what they're doing to mitigate anything, because this is something that only happens to certain people. But I think what I would say is to be aware and to know that it's actually part of the loss of estrogen and the lack of the ovary working that can cause these changes and cause this mood instability or mental health changes. So recognize what it is and then go through the actions that we were talking about. Sleep well, eat well. Don't be afraid to reach out to a healthcare provider, a medical provider, combination of them both, and see if there is a treatment that might be great for you.
And manage stress. Always so important. All of these things. So as always, this has been incredibly helpful information, Dr. Margaret. I know you'll be back soon for our monthly menopause cheat sheet kind of roundup. So can you just leave us with what you think, based on this conversation today, your top 3 takeaways?
My top 3 takeaways are that when menopause occurs, there's a lack of estrogen. Estrogen can set up an environment in the body that can create lack of memory, difficulty sleeping, hot flushes, and mood changes. And those mood changes can manifest themselves either minorly or majorly, depending on the person. It can result in depression, anxiety, irritability, and get help if this occurs. Don't be afraid to get either lifestyle help or medical help or psychiatric help or psychologic help or yoga help or friend help or whatever it is, but get help, because this is basically a normal phenomenon that is treatable, hopefully treatable.
Yes, thank you for those tips. And again, I know you'll be back. And everyone, you should check out menopause-cheat-sheet.com for more information about the newsletter that Dr. Margaret and I published together. And we will be delving into more details about mental health and menopause in an upcoming issue. So thank you again, everyone, for joining in today. And thank you, as always, Dr. Margaret.
Thank you, Barbara. Great to see you. Talk to you soon. Bye all.